module, let's try to learn how exactly a growing long bone receives its arterial supply. In order to understand the arterial supply of a growing long bone, what we'll do is we'll draw the diagram of a growing long bone. And we know that growing long bone has what parts? It has a diaphysis, it has an epiphysis, it has a metaphysis and an epiphyseal plate of cartilage. So let's try to draw the outline of the growing long bone. So what we have? We have the diaphysis shaft, then we have the upper end of the diaphysis, which is referred to as the metaphysis, right? So what we have here, this is the metaphysis. Then we have what? We have a small plate of cartilage, and what we refer this to as, this is referred to as the epiphyseal plate of cartilage, right? So let's write epiphyseal plate of cartilage. On top of this, what do we have? We have the epiphysis, right? So let's say that is the epiphysis. Then we know that a typical long bone will have an outer cortex. So let's try to draw the outer cortex. Let's imagine that is the outer cortex, right? So how exactly the growing long bone receives its arterial supply? The most important artery is the nutrient artery. The nutrient artery enters the shaft or the diaphysis almost at the middle of the shaft, and this enters through a opening referred to as nutrient foramen. Now, how do we locate the nutrient foramen? Remember, the nutrient foramen is always directed away from the growing part of a long bone, right? Remember the dictum? To the elbow I go, to the elbow I go, from the knee I flee. From the knee I flee. This is one of the law of ossification, right? Which tells you what is the direction of the nutrient foramen. Remember, the direction of the nutrient foramen is always away from the growing end. So the nutrient artery, so what is this artery? This is the first and the chief artery. So let's label this as the nutrient artery. The nutrient artery enters the shaft through the nutrient foramen and then immediately divides into an ascending branch and a descending branch. These ascending and descending branch will further divide into parallel branches. So let's say these are the parallel branches, right? Now these parallel branches will give rise to metaphyseal artery. So here they become metaphyseal arteries. So what are these? These become metaphyseal arteries. In addition to this, we have separate metaphyseal artery which are also present. So we have a separate metaphyseal artery, right? Now what is the importance of these arteries? When we talk about nutrient artery, remember, nutrient artery supplies the medullary cavity. It supplies the medullary cavity, and what is present inside the medullary cavity? The bone marrow. And it also supplies the inner part of cortex. Inner part of the cortex. Inner third of the cortex. What about metaphyseal artery? Remember, metaphyseal arteries are also branches of the nutrient artery and they also arise separately. But these metaphyseal arteries show a characteristic feature. They show hairpin bends. They show hairpin bends. Now, what is the importance of this? Remember, because of this hairpin bends or loops, the blood flow through the metaphyseal artery is slow. This can lead to formation of clot or a source of infection. This is the reason why the metaphyseal artery or the metaphyseal zone forms one of the chief vascular zone. It is one of the chief vascular zone of the growing bone. At the same time, this is also the site where osteomyelitis is more common. Osteomyelitis is the infection of bone, right? especially in children, osteomyelitis commonly occurs at the metaphyseal region because of these reasons. What is it? The metaphysis is highly vascular and metaphyseal arteries show this hairpin bend which slows the blood flow and also allows for the formation of clot as well as the sustenance of infection. Right? So this is regarding the nutrient artery and the metaphyseal artery. In addition to this, we have a third type of artery which pierces the epiphysis or the articular cartilage and supply the epiphysis. And what will you call these arteries as? So these arteries are referred to as the epiphyseal arteries. So these are epiphyseal arteries. They exclusively supply the epiphysis. Right? Apart from epiphysis, they can also supply the epiphyseal plate of cartilage. The epiphyseal plate of cartilage can also receive blood from these metaphyseal arteries. Right. In addition to all this, the fourth artery supplies the entire shaft by piercing the periosteum. So you call these branches as periosteal arteries. So these are referred to as periosteal arteries. What is the function of periosteal artery? It supplies, as the name suggests, the periosteum. It also supplies the outer third of the cortex. So it supplies the superficial cortex of the bone. Remember, these are the four chief arteries that supply the arterial supply to a growing long bone. Nutrient artery forms the chief arterial supply because it supplies the entire medullary cavity and also inner part of the cortex. Right? And what is the clinical importance? Nutrient artery gives rise to metaphyseal branches. Some metaphyseal artery arises separately, but these metaphyseal artery have a characteristic arrangement, that is, they show hairpin bends or hairpin loops which will slow down the blood flow and give rise to osteomyelitis, especially in children, because of the sluggish blood flow and increased retention of infectious material. Right? This is regarding the arterial supply of a growing long bone. Now let's try to quickly summarize. The blood supply of a growing long bone is by the nutrient artery, which divides into ascending branches and descending branches, supply the medullary cavity as well as the inner part of the cortex. Then we have the epiphyseal artery, which supplies the epiphysis, including the epiphyseal plate of cartilage. Then we have the metaphyseal artery. The metaphyseal artery forms the chief arterial supply for metaphysis, and because of hairpin bends, this forms a common zone for osteomyelitis in children. Then, in addition to this, we have one more artery which supplies the superficial cortex and also the periosteum. These arteries are referred to as the periosteal arteries. Right? So,